Good evening, everyone. I would like to welcome you to the regular scheduled meeting of the Human Relations Commission of the City of Palo Alto. I'm so grateful to each of you for being with us this evening. We no longer have to vote on the virtual piece.
That is over with.
Oh, thank you. I left, it wasn't. Okay. At this time, we will have public comment. This is a time where if an item is non-agendized, the public can feel free to actually state it. Do we have anybody that has their hand up?
Chair, Elena first needs to do roll call.
Okay, was it on my order?
Oh.
Yeah. Okay. Can we please do roll call?
Yeah, it was not on the agenda.
Vice Chair Eberly.
Here.
Commissioner Causey. Commissioner Shea. Commissioner Kraus.
Here.
Commissioner Savage.
Here.
Chair Smith.
Present.
Commissioner Stimler.
Here.
Chair, you have a quorum.
Thank you so much. We are now open to public comment. I don't see any attendees on the participant list, so we'll move on. Do we have any agenda changes, additions, or deletions? Okay. I need to do a rule check. If I abstain from the vote on the approval of minutes, do we still have quorum?
Yes, and the city attorney clarified a couple meetings ago that you could still approve the minutes even if you weren't there. It's just approving them to form.
All right. We will move to approval of minutes. I will take a motion on it.
I'll move.
Sorry.
We have Vice Chair Eberly has given us a motion. Commissioner Kraus has seconded the motion. Are we ready for the question? Yes? Okay. Vice Chair Eberly?
Aye.
Commissioner Kraus?
Aye.
Commissioner Savage?
Aye.
Chair Smith? Yes. Commissioner Stimler? Thank you so much. Okay. We have approved the minutes. Thank you. This time, we will start with our presentation of the results of the Avenidas Community Assessment Survey of older adults. I will ask that staff do the introductions, please.
Thank you, Chair. So these presentations on older adult services were brought to you thanks to the work of a subcommittee of Commissioner Stimler, Commissioner Kraus. And we are very happy today to have Amy, the CEO of Avenidas, and Michelle, who is the Marketing and Communications Director. Did I get it right? And they will be presenting to you a recent study that they did last year. So we welcome you to the HRC.
Thank you so much.
Thank you. And thank you, entire Human Relations Commission, for inviting us here today. We are honored and delighted to be able to present to you, but more importantly, I want to thank you for your work.
Me?
Yes.
Can you bring the mic closer? Because I'm struggling to hear. I'm sorry.
I'll just lean in. How's that?
That's better. Thank you.
I just want to thank you for your work on behalf of vulnerable populations in Palo Alto. As you know, I'm here to talk about older adults in Palo Alto and how Avenidas and the city of Palo Alto have worked together on behalf of our aging community and to keep us as active and healthy and as engaged as possible. I'm going to share my screen now. The first part is about 10 minutes. I just want to give an overview of Avenidas if you're not familiar with us yet, and give a state of older adults in the Bay Area. There's been a lot that's been changing. And the main part of the talk is around the CASOA survey. This is the Community Assessment Survey of Older Adults that we commissioned in 2021. I want to talk about the findings a little bit and also get into some more potential partnership ideas as well. So the bulk of our time will be spent on Q&A. I know we sent you a lot of information in advance, and so if you have questions afterwards, I'm happy to answer those. A little bit about me. I'm a proud Palo Alto resident for the past 30 years. I'm also very proud to say that I've been a gerontologist this entire time. This is my life's work. I feel very passionate about this work, and I'm delighted to be in this current role at Avenidas. I kind of go from Stanford to Avenidas to Stanford to Avenidas to Stanford, and I'm back. And I have a beautiful team. Michelle Shinseki, our VP of Marketing Communications, is a part of it. My leadership team has over 135 years of experience in social services, healthcare, and gerontology. So rest assured, Avenidas is in good hands.
Amy, if I may interrupt, it doesn't
Absolutely.
seem to be showing on the screen. So I'm wondering if you had it on your screen, but you didn't hit broadcast or.
This one? Can we see that?
There we go.
Thank you so
Thank you.
much,
Thank you for
Amy.
interrupting. Yes, I need that. Is that better?
That's perfect.
Great. And I also want to add this work is intensely personal for me. I, like perhaps many of you, have been a family caregiver for 10 years with my father-in-law, my husband and I. Boy, that was hard. And I have to say, I relied heavily on Avenidas' services to get us through that time. And so we understand that it really does take a village to care for our elders who need them. Now I can't move my screen, so you tell me what I'm doing wrong. Just keep holding it. Okay. And at Avenidas, we're very proud of this village of support that we give to our community, no matter where older adults are in their journey. So I like to say, yes, we are here for older adults, but I also want to add we're here for anyone who cares about them. So I really do feel like this is a community center for all ages. And I also want to say it's for people everywhere. So we have older adults who live here in Palo Alto, and we help their adult caregivers or children wherever they are in the country, and vice versa. We get calls from adult children. My parents are in Santa Fe and in Oregon. We're happy to help with that as well. We really do want to keep our older adults healthy and engaged. Oops. Really push. So that mission and vision, we've been doing this for the past 50 years. You probably know the history as well as I do. We were established in 1969 as a volunteer organization. Then and now, this is quite an innovative model. If you look around at other cities, most cities run their senior center themselves. And it was innovative for the city then to say, hey, let's partner with experts in the aging field. Let's partner with people who really are passionate about this work and create a separate nonprofit. And we're proud to say we continue this partnership with the city of Palo Alto today. Palo Alto provides 8% of our annual operating budget every year, and we are very grateful to that partnership. And I want to say annually, we still facilitate about 52,000 encounters. So about 6,000 are unduplicated counts of clients, but through our programs and services and all of our different events and activities across our 3 locations, we have 2 here in Palo Alto and 1 in Mountain View. That's our service area. And when we think about these encounters, we have anecdotal evidence of what we see changing in the community and in the world. And certainly these headlines reflect that. It mirrors the demographic changes here in Palo Alto, the Bay Area, California, and across the country. Just these recent headlines says every Bay Area county is aging faster than the US. Did you know that the fastest growing homeless population is seniors? And senior service providers are fighting to keep up. So what we know from this information is that the demographics are changing, and the status quo, the way we've operated for the last 50 years, needs to change as well. So let's think about this demographic shift. We know a lot of it is because of the baby boomers. They have changed the way we've done things wherever they are in their lifespan. They have arrived at old age. This gray tsunami that I don't like calling it is here. And they are going to change the way we do aging services as well. Here in the Bay Area in particular, we've also lost working age adults, school age children because of the pandemic, tech layoffs, and the high cost of living. So what we're seeing, and this is the picture that I like to look at, is we're really close to this inflection point in 2030 where there's going to be more people over the age of 65 than under the age of 18.
Wow.
And just so you know, we're already there in Palo Alto. We've got a lot more older adults here than the California does. And I'll also add here, you can see that in Santa Clara County, that age 60 plus is projected to grow 200% by 2060. So again, that's at the far right of the graph. You can see the vast difference between the number of youngers and olders in California. So I feel passionate that Avenidas has a responsibility to this community to not just bring our passion and our heart to this work, to care and to make sure older adults are safe and happy and healthy, but we have to pair it with our brains and be smart and use data to drive our decision making. So in 2021, in an effort to draw out the voices of our community's older adults, we commissioned a survey with Polco. If you're not familiar with them, the National Institute of Research is what it used to be called. And they're the ones that do the US Census American Community Survey every 10 years. They're highly reputable. We gave that out to our 60 plus service area, so Palo Alto and 8 other surrounding communities. And this instrument is highly valid for their survey research as well as knowledge of aging services. What I appreciate about this study is it also has national benchmarks so we can track how we're doing. So I'm going to start with the good news. Palo Alto is doing great on some of these things. Of course, 95% of Palo Altans think Palo Alto is a good or excellent place to live, and I have to agree. 88% thought the design and the layout of the city is great compared to others in our surrounding areas. And the natural environment and access to outdoor health and wellness activities was also rated more highly. But, the two biggest questions we get at Avenidas are kind of come in two big buckets, which is how can I afford to pay everything I need to? And who is going to take care of me when I get older? Or how can I get help caring for the people I do now? And while we have that anecdotal evidence, even the New York Times wrote about it this past Sunday, it's important to have these findings. And it's no surprise that these 3 areas rose to the surface, which is housing costs are on their mind, the cost of living is on their minds, and caregiver support. So with housing options in Palo Alto, only about 19% feel that the accessibility of available housing here is good or excellent. In the surrounding areas, it's closer to 40%. Not surprisingly, the cost of living, not a great score. About 3% of Palo Altans think that the cost of living here is good or excellent. I don't know who those people are, but that's that. Now, the caregiver support was a surprising finding for us. Already, of our 60 plus population, almost 40% of them are already caring for someone who's 55 years of age or older. And this number is only going to grow. We also asked about the daytime care options for older adults, and 31% of Palo Altans thought that was adequate, and 49% of Mountain View residents did. So the good news, we really feel that this continued partnership with the city of Palo Alto is important and will set us up well to address how we change how the world is changing and address those needs. Couple of examples, housing. We are working with the city on a housing conference that's coming up in October 14th. It's free, thanks to the city. And we hope to see all of you there. The tracks are going to be aging in place, different housing options, and affording your housing. With the cost of living increasingly, our social workers have been getting more and more calls around the question of, I can't pay my bills. I can't pay for my prescriptions, my utility bill, you name it. And so this form of scholarships or emergency funds is a need for us that's growing rapidly. There are people here in Palo Alto, you probably know this, that yes, are house rich, but extremely cash poor. We also have individuals, whether they're renting or owning, that just can't keep up with the rising cost of living in the area. We do fundraise for these scholarships and these emergency funds, but see this as a potential of area for us to partner. And our caregiver support, I'm proud to say that our Avenidas Care Partners program, which is run by our social workers, has about 1,700 encounters every year. And our annual caregiver conference is always oversubscribed. It is a testament to the intense need for resources, for support and community for this difficult job. I will say AARP just released a report that most people, well, I'll say it's for people age 60 plus who are already caregiving, 30% of those are also taking care of children. So this idea of a sandwich generation is quite real in this community as well. Our caregiver conference was held in Mountain View this past year, and I think this would be a fun way to collaborate as well in future years. And then finally, we're very proud of our Rose Kleiner Adult Day Health Center. We used to be here in Palo Alto, but we lost our lease in the early 2000s and could not find other space here in Palo Alto, so moved to Mountain View. And I just think as we look to the future on meeting the needs of older adults, I think it might be a good time to reassess the age segregation that happens in our culture and rethink the use of space and resources. I'm a firm believer of intergenerational programming. I think older people have a lot to give back, and I think younger people do too, and we're hungry for that kind of connection. So before I get to the Q&A, I just have one confession to this group. I am ageist. And if you believe the World Health Organization's latest report on their global report on ageism, most likely all of us are. And it's important to note here that we all hold these ageist beliefs about others, but also about ourselves. And this kind of internalized ageism is particularly damaging. We see that a lot. If 85-year-olds come to our center and say, well, I'll come here in 10 years. Nobody wants to say they're old. Did you know ageism shortens our life by 8 years? I'm here to encourage all of us to embrace our aging. But the other issue is it intersects with ableism, sexism, racism, all the other isms that we have in our culture. It's detrimental not just to us as individuals, but to our community. So I want to point out October 7th is National Ageism Awareness Day. And I always like to say too, yes, we have many sticky problems in our world that we need to solve. Yes, there are huge needs also in our older adult population. And, not but, and we also know that the vast majority of older adults are an underused resource, both here and around the world. So what do I mean by that? We are uniquely qualified individuals, highly experienced, exceptionally emotionally intelligent, motivated by generativity, have time and resources to give back, and because of ageism, haven't been given the opportunity to contribute in this way. So when we talk about solving problems, particularly around the needs of older adults, please include older adults as a part of the solution. So that's all my planned remarks. I'm happy to take any questions. If there's questions that come up, I know we're going to keep track of them because I want to get back to the commission with the right answers and not come up with it. So thank you.
First of all, thank you so much. Very informative. Even solicited a reaction from me. So, great information. I'd love to take a moment and have the commissioners that work with you, Commissioner Stimler, Commissioner Kraus, who serve on the subcommittee, to share their thoughts or findings. And then after that, I will go to public comment if there's any, and then we'll do round robin questions with the entire commission.
Chair, did you want Amy to leave up her presentation or what would you prefer?
Let's do faces for now.
Okay.
If we have to go back to a presentation, we can come back to it when questions come. Okay. The button.
Thank you so much for coming. This is very informative. I did actually read through the entire report that you shared with us in advance, and I do think you summarized it very well. It's interesting. We have kind of complicated challenges around our aging population in Palo Alto. I think the expression house rich and cash poor is an interesting dynamic, and thinking about how can we help those who may be having that situation in our community. One of the questions I'll ask later is just around the survey was conducted in 2021. I'm curious, because the pandemic really had outsized impacts on the elderly community, how you see them either bouncing back or not bouncing back. I saw in the report that I think it was 39% of respondents said that they had concerns around isolation and loneliness. Maybe that was a point in time, August of 2021, we were still kind of coming back from social distancing, but I'd be curious if that continues to be a concern, or if you see that people have fully come back, or if there are maybe some folks who haven't returned after the pandemic. So those are some of my questions, but I think we're going to do discussion in a little bit. So,
Commissioner Kraus,
I'm sorry, my voice is.
can you press the button?
My allergies are nuts today. There's something in the air. So you'll hear me cough, but there's nothing communicable other than my DNA. In any event, thank you. This was an extraordinary presentation. It provided us with an overview. What I'm most concerned about is housing, because we have such an issue with affordable housing. And as this population ages, it's going to become more necessary for us to figure out the full gamut of what that looks like. I'd also like at some point to see kind of a matrix of how we do with housing, how we do with food, how we do with social services. Unfortunately, last October, I took a tumble over one of those cement blocks and I fractured my knee. And I'm fiercely independent. I had no choice. I had to have help come in that night after I was released from Stanford. It was extraordinarily expensive. I spent probably, now this is not skilled nursing, but probably $2,000 per week. And I was lucky I could get that.
Mm.
And I'm now a great resource because I know the families who come and they come on a moment's notice. But how are we going to deal with that? The costs are hugely expensive. And we have more people every day that are having injuries that are age-related. What do you do if you could not afford it? So I'd love to have a longer chat with social services that become available to the aging population. I'd like to see how it intersects with food, because they need to eat, they need to sleep, and they need to be cared for. And indeed, this population is getting older. We all came to the valley in its heyday, and it was exciting and wonderful, and God bless us all for coming. The world has changed, but how do we do this as a city? And how does the Human Relations Commission begin to get their hands around this?
Thank you so much. Do we have anybody for public comment?
No, we do not, Chair.
Thank you. All right. This time we will start with round robin questions. We will start from the top of the alphabet. We will go with Vice Chair Epperly.
Thank you. Thank you so much for being here. I feel like this conversation is very timely considering all the news stories. I know you mentioned an article in the New York Times and what's happening in China. So I feel that it's something that we definitely, need to tackle and come up with solutions. I have a question that kind of intersects with housing. And my question is, what stance does Avenidas have, if any, on the ADUs that are coming up in Palo Alto? I know that there's an effort by the Planning and Transportation Commission, PTC, to require them to be part of the rental registry. And there's some pushback from house owners because they came to one of our meetings about having to put it on the registry to have a little bit more flexibility on who they rent to since it's part of their, property. So I would like to know if you have any idea of how your, the older adults that are part of Avenidas feel about that. The other is, have you looked into, you mentioned house rich, cash poor, and the good that comes from intergenerational bonding. Are some of those older adults that live in those houses willing or want to rent out rooms to young professionals? I mean, I know a couple of older adults in my neighborhood that do that. So I feel like it can be very successful. I know, so I'm just wondering, is that something that's prevalent? Is it something that people are looking into? Is there a way that they would feel maybe there's some safety concerns, but maybe Avenidas can vet potential renters? I'm just wondering if you look into those two things.
Yeah, so two things. I'll start with the kind of intergenerational shared housing. Santa Clara County at this point does not have that anymore. They used to have a program. San Mateo has something called HIP housing, and it's going really well. And so it's something I think, despite the fact that it didn't go well in Santa Clara many years ago, it's time to bring it back. I think the issue there obviously is the vetting and safety and matching people appropriately. And now with all the wonderful tech we have, it's, if you have a partier, you can have an 85-year-old partier and a 28-year-old partier that can share space just as well. So,
yep, you can.
Or if you have insomnia, it doesn't really matter. So that's that shared housing piece. I know, for example, colleges have done the same thing. They've had students who can't afford their dorm and their room and board live in a senior's home, and they get free room and board in exchange for helping out with picking up groceries and mowing the lawn and that sort of thing. So I think there's a lot of innovative models out there, but we just haven't done it here yet. To your other question around advocacy for the ADUs or DADUs. Right now, Avenidas, we had a big discussion this past year at our board retreat. We are not an official advocacy organization, so we're not going to put out a public statement to that effect. I think what I think the right thing to do is to find out from our older adults how they feel about this. And then we would have their voice involved.
Thank you. I think some of them have come to our meetings,
I
so we appreciate that. We appreciate whenever anybody comes to our meetings, so thank you.
I just want to actually have our council liaison speak before I go into a deeper dive. Councilmember LaSky Haynes.
Chair, sorry I was late. It's always wonderful to be with the HRC, and I'm glad that I didn't miss any of your presentation. Thank you so much for your work here in our city, and this survey sounds really thorough and illuminating. And thank you for making me think about my own ageism. It's something that at 55 I need to embrace the aging underway in my own body, and the way in which I may not be fully appreciating older people. So thank you for calling that out for all of us. I think that was really beautiful, if hard. The question that I had that wasn't, a subject of the survey, but that really pertains to your work more broadly is the recent dispute with not dispute, the difficulty and the relationship between Avenidas and La Comida. Both of you are aiming to serve our seniors. And for those of us who are on the outside, it was a bit perplexing to try to discern and understand what's gone wrong in that relationship and what is being done to bring these organizations back together for the sake of our seniors. And I wonder if you're comfortable commenting on that, even though it's a little bit off topic.
I'm happy
that
to,
okay?
absolutely. Even before I started in this role, that was the first question I got from the press. The Post was all over it. I will say that Avenidas and La Comida have worked together for decades. And it was an unfortunate series of events when we had to remodel the 450 Bryant location to be earthquake safe, that pieces of it that we thought would not be historical turned out to be historical. So we've always planned on building around La Comida's needs. So the side that has the garage was deemed historical. That whole side was going to be for La Comida. When we couldn't tear that down, we added a third story and wanted the other side of the building to be all for La Comida. Then the fire department said we had to put in this really large staircase, since we had a third floor, that bifurcated that space. And there was no other place to put it. And that's when La Comida looked at, they wanted 125 seats. We could only give them 90, and that's when they decided to leave. So the most recent piece is during COVID, they did really well with pickup meals, didn't have congregate meals. And then starting July 1st, the congregate meal program, the SNAP program here in Santa Clara County said, hey, you gotta try to go back to person. So the good news is they have their kitchen in Stevenson House in South Palo Alto. They're able to serve a lot more seniors now that they have 2 locations. So they have seated dining in Stevenson House. And they're working with us. We have temporary place for them in our building, as well as a tent in the back. So kind of like the restaurants we have here where you can eat inside, but if you're a little worried about eating inside because of COVID, there's an outdoor space as well. I do know that and it's going really well. Michelle and I have been working really hard to make that happen. We're delighted that we can help them out in this way. And we're also helping them find a permanent location, because what they want is a room that seats over 100 people.
Mhm.
And we just don't have that. And so we're trying to find that for them.
Thank you so much. Commissioner Shea?
So thank you so much for your presentation. I have lived experience as a caregiver for my father, who was in his 80s when he passed away in 2020. So thank you. So I participate on a subcommittee with Vice Chair Eberly and Commissioner Stimler. We are analyzing the recent results of the AA-NHPI survey. So I have a question related to that. So based on your analysis, are there any particular needs that are unique to AA-NHPI older adults here in Palo Alto?
I would say absolutely, and it probably doesn't come out of this study. I don't think we had that level of nuance, but I would say any group has special needs. And in order to have that cultural sensitivity, it's something that we're working on. So for example, we have our Rainbow Collective for LGBTQ seniors. We have our Chinese Community Center. For the populations that we have a lot of, we know more of, but there's a lot we don't know yet. And so I'd be curious to find out more from you about how to train our staff on that cultural sensitivity, and also make sure we're reaching those populations too. I think that's an important piece of the marketing and communications, to let people know all are welcome here. And we want, when people walk in the door, to feel like we can speak their language, both physically, but also just understand where they've come from.
Thank you very much.
Thank you. Commissioner Kraus? You're good? Okay. Commissioner Savage?
Hi, thank you for the presentation. It was very good. Most of things I've been thinking about have been brought up already, but a couple things, housing for seniors is a big one in my mind. It's, I don't see any real answers yet. But back to the survey, I'm just curious to know, what would you find as the most surprising or rather the most disappointing finding in the survey?
There was one question about, and I'm not going to get the question exactly right, but something along the lines of, do you know who to go to for senior services in your area? And while benchmarked with national data, it was very high compared to national benchmark. It's not high enough for me. I want that number to be 100%. And so I think that was one area where I was like, I feel bad if, I think it was something like 70% of the respondents were like, don't really know what's Avenidas or who's La Comida. Who would I call if I had a question about aging, either social services or health services? So to me, that hits hard in the heart.
Yeah. Was there something the HRC can do to move that along, help out?
Ooh. Michelle, would you like to answer that question? My marketing person.
Always. Thank you for asking. One of the things that I think Amy and I struggle with when we know that we are doing good work every day, we can see it in the faces of our participants, is that we know that there's so many more people to reach. So we are trying to partner with as many like-minded organizations as possible to make sure that people know that these services are available, and it's not just yoga and exercise. It can be therapeutic services. It can be social work. There can be many, many things. And in a lot of ways, we try to customize for every person who comes into that door, no matter where they are on their journey in aging. So if that is an offer, then yes, we always want to make sure that we can partner.
Thank you.
Commissioner Stillman? Mic button, please.
And sorry, Chair. Okay. So I just returned to the couple of questions I had mentioned earlier. One is, obviously there's just a trend towards an older population generally. So that's what, these are concurrent, but with at the same time that we went through a pandemic. But I'm curious if you're seeing any needs emerge now that are pandemic related or post-pandemic related, given that the pandemic had such an outsized impact and continues to have an outsized impact on our most elderly.
I would say the continued impact of COVID, at least from our perspective, is less a healthcare concern and more an economic one at this point. I think the prices of everything have gone up.
Yeah.
Healthcare access, we get this a lot. It's taking 8 to 9 months to get an appointment. It's just been really difficult on a lot of areas, given the lack of workforce availability, the cost of things. And so it's just been this ripple effect for people.
Yeah.
I do know increasingly older adults who live here, their younger relatives have moved away because they have to, and they can't afford to live here anymore if they don't have a job.
Yeah.
And so we're losing that social connection of family, and we're seeing that as well.
That makes a lot of sense. There were 3 areas that you mentioned that were sort of the needs of the community: housing, cost of living, which you just mentioned, and caregiver support. I'm curious, you had such creative ideas just around how to integrate some of the needs around cash. Sorry, not being wrong. House rich, cash poor. I'm curious if you have other interesting or innovative ideas around the other 2 issues around cost of living or around caregiver support that you just want to raise to the commission.
Gosh, I wish I had an answer to your cost of living question and your healthcare cost question or home care cost. I don't.
Yeah.
I'm going to keep working on that. But with caregiver support, I do think there's a lot we can do. And one of my roles was with Stanford University Human Resources. Avenidas has a contract with them. So as you know, at larger institutions, they have a work-life office, and primarily that's around childcare. They either provide childcare or offer stipends for childcare. And what Stanford is trying to do is have more of an elder care piece. The average employee age at Stanford, when you include staff and faculty, is almost 50 years old. Most of them don't need childcare, but they need help with elder care. And so my big idea would be for large employers to have elder care be a big part of their employee benefit. That would be huge. And the other piece that I think is really key, and it's somewhat related to your question and a little bit related to yours, which is hospitals and health plans increasingly need to partner with community-based organizations to provide things that we know, they're called social determinants of health. It's not a doctor's appointment, it's not a drug, but it's food, it's transportation, safe housing, electricity in your housing so your medication doesn't go bad, social support, all of those things. So I'm proud to say we're participating in CalAIM's Enhanced Care Management with Santa Clara County. So we'll be doing that with the Santa Clara Family Health Plan. So that's just for Medi-Cal participants. In January, CMS is requiring all hospitals to refer their patients, not just take in the information, but refer them to CBOs who have a need in their social determinants of health. So the question there still is, since it's Medicare patients, who's going to pay for that on our end? Luckily with CalAIM and Medi-Cal, there's a cost sharing. So the health plan and CBOs get a per patient per month dividend. With Medicare, it's not happening yet, but I have every hope that with Medicare Advantage that we can continue to partner with hospitals and health plans to make sure that there isn't this weird dark hole. So your doctor just sees you, what, once a year or whenever you have your appointment or at the surgery, and then they send you home and there's this gray area of we don't know what happens there. We don't do home visits. We don't see them in their community. And it's really important for our nursing staff and our social work staff and our drivers and everybody else who delivers meals or groceries. We have eyes on these people, and having a way of communicating that and caring for the whole person, not just the medical need, is really important. So I'm hoping that kind of helps with the caregiver idea as well.
Wonderful, thank you.
Thank you, commissioners. In your presentation, you made a specific statement about scholarships to help seniors with like medication and other needs. I once experienced a senior couple that only could buy high blood pressure medication for one of them. So they split the medication and then one ended up in the hospital. So I would be very interested to hear what are the dollar numbers, the total impact and the budget. I know we sat here. This seems like something that could be partnered with through the next HISRAP process, which is, I think, 20 months off, right, Inka? But it's we could definitely talk about HISRAP or CDBG or some other, but I'm just curious to get numbers on people and dollar amount that you're doing with scholarships at this point, and how much of a need is it?
Okay, I want to get actual numbers, so we will have to get back to you on that. I do know I sign those checks, and so it's everything from $300 for a dentist visit that wasn't planned for. It's for medication. We now understand that Housing Industry Foundation, they help with some emergency funds for rent if you need it. So we're trying to partner with other institutions that have these types of emergency funds. Right now, I want to say our budget was what, $4,000 this year. It was pretty tiny. We're doing more fundraising through Wishbook and a couple others to bring in more money for that funding because it's gone before we even say go. There's a huge need.
Emerging need fund?
They just got sent that, so yeah, they have that.
Oh, because you're aware of the emerging needs
Yes,
fund?
yes, Christina and
Okay.
I are on it.
Okay. Because I know that sounds like an emerging need. Anybody has any other questions? Yes, Commissioner Krause.
I would love to get some data back on how you coordinate. Where do you share? Where are the points of connection? Meals on Wheels, La Comida. Where do people go for food? I know JCFS has a food kitchen. And is that information shared? You know, where are your points of connection? And how can the HRC maybe help you with those connections?
Yeah, so when people call in our INA line, our information and assistance line, they typically go through our social work staff, and our social work staff are incredibly well-versed in everything that's available to them,
Mhm.
not just housing, but transportation. And if we can't do it, it's, we refer out a lot. So we can get the numbers to you on how we do that internally. But I'll have to say this, there's no dropped balls. It's an extremely tight organization in terms of warm handoffs and not just saying, here, hang up and call this number. It's let me get all of this information for you, and then I will get back to you and make sure that you get everything that you need. It's extremely important to us that it's not sending them down these rabbit holes. And as you know, these things change often too. So one day the grocery pickup is on a Wednesday and sometimes it's on Thursday. So making sure that they understand all of those nuances is really important.
And also that new Palo Alto service that takes people around, is that having an impact? And if so, what's the utilization? And what's the extent that you can put people in for utilization? That new service.
The Palo Alto link.
Yes.
Yeah, so far we haven't seen, I don't know the data for PAL. I do know our transportation numbers, and we haven't seen like competition there because we really are serving maybe a different population. Most of our transportation is for people who need to be either picked up at their home or actually need someone to help them out the front door and get into the car.
Right.
And then the other piece is the tracking. So if I, as an adult child, say I'm arranging a ride for my mother to go somewhere, if she has cognitive difficulties, I'm going to want to keep track of where she's going. And that's something that we can offer as well.
I'm just curious, if
Yeah.
that's alleviated some of your issues and it is Palo Alto Link, or if it's business people or students.
Who are using Palo Alto Link?
Yeah.
That I don't know. That is,
I don't
I'm
know
curious
the
too. I don't
answer.
know.
That's a city programming. I mean, I can check with our transportation department if they have any kind of metrics
be
or anything like
useful.
that.
Because just recently I asked someone, well, why didn't you do this? They didn't know it existed.
Thank you. Do we have any other questions for the nice people? Amen. Sorry, can't say that. Wrong job. Wrong job. Wrong job. I'm a little tired. First of all, thank you for the phenomenal work that you're doing for our community. I know I do not speak for just myself, but for the entire HRC. Avenidas has a golden and stellar reputation in our community, and we're grateful for the in-depth work that you do. We will look for, we are interested in ways that we can help communicate to the wider community the services you give, and B, as we get into funding his wrap for the next cycle. I know you have the application for emerging needs. I think being on that selection committee over the past few years, that scholarship program, I'm not guaranteeing anything, but I think it would pique the interest of a committee. Yes, Minka.
I was going to just add, and now I've already forgot about it. So let me say. One is Avenidas does not apply for HISRAP because they're a direct service provider with the city. They used to be within the HISRAP bounds, but they can apply for emerging needs. Did I misunderstand you?
We have other organizations that get direct funding from the city and still apply for HISRAP.
Pardon me?
We have organizations that do both in that are HISRAP grantees. I'll text you.
HISRAP and CDBG, or?
No, HISRAP and city funded.
Yes, I know what you're. I know what you're alluding to. That would be another discussion because Avenidas and Palo Alto Community Child Care specifically requested to be out of HISRAP, I think in 2018, 2019. They used to be part of HISRAP.
Why? I'm just confused.
it's a longer discussion. I'm happy to go over it now with you if you'd like, or,
No,
okay, that's all right.
let's not keep everybody here all night. We
I
did that
know.
on Monday. But I just want to get them every possible resource, maybe something that 2018 that made sense probably doesn't make, we might not make sense in 2023. So we can have that discussion, but we want to get you as much funding as possible because I see the impact of seniors and I know that they need resources, particularly around house rich and cash poor. All right. We've closed this item. Thank you so much.
Thank you.
All right. I see Claire Campbell is she still on the line?
There she is.
Hi, Claire.
Hello.
We're CDBGing it again. So
Yes, we are. It's that time.
it is that time. We're on item number 3. Information item, summary of fiscal year 2023 Community Block Development Grant Program accomplishments, review consolidated annual performance and evaluation report, and that will be Claire Campbell.
Yes. Good evening, Commissioner and excuse me, Commissioners. So we're back here tonight with a new CDBG item, and we're going to be reporting out on the progress of fiscal year 22-23. I just wanted to give the Commission a few updates on the program. So currently, we're getting ready for the next CDBG NOFA, which we're planning to issue later this fall. And then we'll be back in front of you in early 24 with the actions for the CDBG funding allocation. So that'll be the next step that we've got planned for our CDBG program. So here with me tonight, we have Tina Roseberry. She is our CDBG consultant, and she's going to provide a brief presentation for you today on the CAPER. Take it over, Tina. Thank you.
Okay, thanks, Claire. I'm going to share my screen here. Everyone can let me know if everyone can see this. Hold on, I put the wrong thing up. There we go.
I'm not seeing anything.
We see it over here. Oh, wait a minute. I forgot to click the last thing. Sorry. Okay, here we go.
Screen. Yes, we do.
There we go. Sorry, everyone. As Claire said, I'm Tina Roseberry. I'm working with the city with your CDBG program and the Human Relations Commission on several different things throughout the year. So annually, at the end of the fiscal year, we have 90 days to prepare basically kind of like a monitoring report, the Consolidated Annual Performance Evaluation Report. That's a lot of words. They shorten it, call it CAPER. And the CAPER just lets us know and lets the city know how we're doing for the year. And so tonight, the purpose of it is to let everyone know that a report was created and it's been on display for the last, it is on display for 15 days. And it's up on the website. It's been put on in the newspaper, as well as this report shows the accomplishments for everything that happened in fiscal year 2022 to 23. So basically, what I would call 2022 program year. And through our citizen participation plan, it requires us to have a public hearing with the HRC committee here. So the CDBG program, some people might have been involved with other presentations we give on CDBG, but this Community Development Block Grant is a federal grant program. The city gets they're an entitlement that gets an annual allocation every year. And the program basically has 3 national objectives that every activity that we do, every activity that we approve has to stay within the guidance of those 3 national objectives here. So one is to benefit low and moderate income persons. Another is to eliminate slum and blight. And another one is set up for things that are urgent in the community. If something's really impactful, we can work through HUD's program to have something that has a sense of urgency. Something, it may be a low to moderate house is falling down, and we might be able to use extra program funds to rehab that. So those urgent needs. So the CAPER report is submitted annually, like I said, 90 days after the program year ends, and the report goes into HUD. But for everyone to know, all the activities and all of our accomplishments and all of our funding has to be consistent with the 5-year consolidated plan. So we're on right now going into the new NOFA, we're going on our 5th year. But the 22 was the 3rd year of that 5-year plan. So we're right about, the end of like the middle of that 5-year consolidated plan for this CAPER. And that document summarizes all the achievements for each program. And sometimes the program for CDBG focuses in on a variety of efforts, but then the city adds some things to it, like downtown streets and other types of things that the city's funding planning wise that kind of fit in with some of the goals and objectives for the CAPER as well. So when we talk about funding, the funding sources that year for 22-23, the funding was $513,168. There's also program income coming back from that relates to Alta housing. So a total amount of funds that we had to program and spend were $620,468. So all that was allocated into a variety of projects. But if we had to look at the big picture, this is how generally we're spending the funding. A percentage of it is going to housing rehab, public services, planning administration, and public facilities and improvements. There is a cap that goes on to public services. Only 15% can be spent on public services. Sometimes I say to myself, unfortunately, because just like the presentation before mine with senior citizens, there's just so many different great services out there, but only 15% can be spent with CDBG dollars. Up to 20% can be spent on planning and admin. So in a recap, like a brief recap of the 22-23 activities, here's the public services, admin funds, public facilities, and housing rehab dollars that were spent, and the subrecipients of those. So I won't go through them all, but here they all are. And then just to know a little bit about our public services and what those subrecipients do out there. Alta Housing is providing on-site counseling in some of the housing facilities that they have, and they do awesome case management services. So the CAPER is a accomplishment measurement metrics kind of document. So they have goals that they set. So Alta Housing typically exceeds that. They had 148 residents that benefit from the case management. Catholic Charities assisted 62 low to moderate income and elderly residents. Life Moves, and this is what they do. They're a part of this Opportunity Services Center, and they provide case management to homeless individuals. 49 were assisted. Silicon Valley Independent Living Center, they do case management services as well. 24 adults with disabilities and mobility type of disabilities were assisted. And Project Sentinel, which deals with fair housing, they assisted 22 low and moderate income residents. So also Project Sentinel gets some of the city's planning and admin money. So they received additional support through the admin 20% cap, as well as administrative fees for administering the program. So that year, if you remember the pie chart, a large percentage of the funds are going to a facilities type of program. So public facilities improvements that are associated with 525 East Charleston Road, which is otherwise known as Mitchell Park Place. Some affordable housing units are being developed there. As well as housing rehab, Rebuilding Together Peninsula. They have what they call their Safe Home program, and they've assisted 5 households with housing rehabilitation type improvements, mostly dealing with safety, weatherization type of projects. So our last step towards this is waiting till we get through our 15-day display period. This will be on the consent agenda for council, and then the CAPER gets inputted into HUD's system and gets submitted by the 28th of September. And that's kind of a brief, hopefully it was brief enough, Claire, for everybody. But if there's any questions that anyone might have, I'll stop. I'll leave the presentation in case anyone wants to go back into anything, but I'm here for any questions.
Thank you so much. Can we open for public comment?
There are no participants.
Thank you. Council Liaison, commissioners, do you have any questions on the report as presented?
I have a couple of questions.
Thank you.
Just first to clarify on the staff report, I just want to make sure that what I'm thinking is correct or not. Number 4, Project Sentinel. It looks like the goal was there was an outreach goal of reaching out to 100 people and then, 15 actual case management. So then you have goal assist 100 individuals, actual 22. Shouldn't it be assist, like case manage 15, and then you case manage 22? Or am I wrong?
You're not wrong. I think the biggest thing when we're delivering this information to HUD, I had a variety of questions come back this year from HUD and our HUD rep that they really want us to, although Project Sentinel does a lot of great work and they do a lot of outreach things, and that information is found in the larger report. And we should have probably put something in here about that, but I know the HUD rep wants to make sure that our national objectives are being met, which means for Project Sentinel, it would be low to moderate income, helping those individuals, low to moderate income individuals. So that is how they met the national objectives, through that particular number. But yes, you are right. They do a lot more in terms of settling discrimination cases and outreach. They do lots of flyer sends out to various residents throughout the city, as well as different boards and committees and neighborhood groups.
I guess it's just that it looks like it did not meet its goal the way that you have it on the staff report right now. That's
okay.
all. Because it looks like your goal was to assist 100 individuals, but actually only 22 individuals. But
Okay.
that's not the case. It looks like, they reached out to 100. I don't know how many they reached out to. I don't know how they keep that number. But it looks like they had a goal of 15 case management cases, and they actually had 22. So they actually surpassed their goal. So just, FYI, I don't know if HUD gets this or they just get the longer report, but it just doesn't look like they met their goal, but they actually surpassed it. And the other thing, on the Eden Housing Project and Mitchell Park Place, is it going to be a problem that the money then, it seems to me, that was not spent in the 2022-2023 fiscal year because construction didn't start yet? Is that going to be an issue with HUD?
Every year the city any entitlement has a timeliness test. So luckily we spent monies in other ways and prior monies to reach the timeliness after we paid all our subrecipients and administrative funds. But yeah, it's true. The HUD does like you to spend money in the time period within that fiscal year, which is July 1 till June 30th. So it is conversations that I know that we have with the city, with staff every year on, is a project really ready to go? And Mitchell Park, they thought that it would go a little sooner. I know they were looking for low and moderate income housing tax credits, and that took longer to be awarded those than was originally anticipated. But it does affect the timeliness, and we worked with HUD through those responses and questions that they had.
Okay, thank you so much. I'm
Mhm.
I'm part of the CDBG ad hoc committee, and I know I owe an email back on my availability, but I'm looking forward to working with everybody. Thank
Oh,
you.
thanks so much.
Any other questions, commissioners? Yes, Commissioner Krause.
Quick question. I'm looking again at the staff report, as is Vice Chair did, on number 7. Could, your goal was 355 individuals. And did you reach your goal? It's just confusing. And then I'd love to have some more specificity on safe at home. Because
Maybe I'll start off with a response if you're ready on the
I'm ready.
525 East Charleston.
Yeah.
So as Tina was just explaining, this particular project, it's taken them some time to organize the funding and things like that around getting the project off and running. So right now they're in the stage where they're getting their bids together. Excuse me. So essentially, they haven't done anything yet with the project.
Gotcha.
Excuse me. And so that is why it's a 0 being reflected in the staff report. But so they were supposed to assist 355, but the actual is 0. But we're anticipating, with this project moving forward, that we're going to see a different number next year, that we can, update the HRC on that project. But we do not anticipate, these things happen sometimes where projects are delayed, but we have parameters within the program that we can adjust for to still be able to fund the project and to move things forward.
Thank you.
So hopefully that explains that
Yes. And
number, which stands out in the report.
Thanks for explaining that. It makes sense now. Safe at home. It seems to me that there should be more, but did we fund it for this amount at this point? I would imagine that with the growing senior population, that houses need these kinds of rehab so the seniors aren't falling, tripping, not making their way through their living room, etc. Are we gonna take a hard look at that going forward? Claire?
Yeah, so so Rebuilding Together we've been funding their work for a few years now, and they do struggle meeting their goals. So even though we give them around 75,000, something like that, they do have some challenges getting applicants who qualify for the funding for their rehabilitation projects. And Tina can kind of speak a little bit more to those details, but I think it's a struggle in Palo Alto because when you look at their assets and things like that, if they own a home, sometimes that can push them out of the qualifications for being able to receive CDBG funds. And so it sounds like it should be a well-used program, but it's actually a little bit challenging to get applicants in the door that qualify for assistance. Tina, do you have something to add to that?
Well, they are struggling. They only have a small wait list for the city. And so $73,000 a year, if we look at it this way, their goal was to get 4 done. They actually did 5. The cost of construction too, like the cost of construction prices went up. So they're each getting, if you divided, how 5 homes into the $73,000 that we're giving them, that's like 14,000 or so. And what, yeah, and what all you can, and when they really focus in on getting the codes things done and weatherization, things that might lower their monthly bills. And if they get a roof replaced and some windows done, or say their porch is falling off, just that money and how far it's going to stretch doesn't stretch as much as it used to. So they're only able to do right now 4 to 5 homes with the 70-some thousand. But I know they took them longer than they thought it was going to. Number one, that by the time they income verify, maybe at the end they didn't, their household income, because it has to go by everybody in the household who's earning an income, their household income is just over the limit. And we are trying to keep it to HUD standards for low to moderate income limits that they set annually. So there's just, they struggle with that. And it's an objective maybe this year to see if we can get the word out more about the program. Maybe that might help it out a little bit more. If you have some thoughts on that, to get back to Claire or
So-
us.
Sure.
I will say this, I've been on this commission, it's gotta be 6 years now. And because of the economics of Palo Alto, housing value, income values, this segment of the program has struggled mightily because we are an outlier on our national averages that really throw us off, and we just can't get the mathematics to work. So even when we advertise it and get the applications, it's just the numbers and the economics of our area. Again, I think Avenida said it best. People are house rich or asset rich, but cash poor. And even when you start mixing in the HUD stuff, even what we consider cash poor here is better than the national average as cash poor. So it's just a math problem that unless they start doing graduated scales, we'll never get it to work correctly here. All right.
Just a footnote, our systems have gone down.
No.
Amy's, mine.
Okay, staff. All right. So we are so grateful. Does anybody have any other questions? Claire, what is our next interaction with CDBG?
So the next one will be us coming back to the commission. So we'll be meeting the next time with the HRC Selection Committee to discuss the funding allocations, and that's going to happen maybe in December. And then following that, we're going to come back to the full board in probably February to do the allocation decisions or recommendations for council.
All right.
So that's next steps.
Thank you so much. So we'll see, all of us will see you in February, but it's Commissioner Vice Chair Everly, and who else? Who's
Commissioner Causey.
Okay, so Commissioner Causey and Vice Chair Everly will see you in December. Thank you as usual for all the amazing work, Claire. Thank you, Tina.
Thank you.
Thank you.
All right. Are we good technically? You can use mine if you want. I don't need it.
Well, we don't have any more presentations,
Okay.
so
All
we
right.
can just look.
All right.
Can I ask a weird question? Do we have to redo roll call? Can we redo roll call so that Commissioner Shea can be counted as being here? She missed roll call, but she's here. I was just curious if we have to.
But
redo
she
it.
asked the question, so she'll go on the record
Okay,
as being
great. So
present.
she's here. Okay, cool.
When-
Just want to make sure you.
Once you talk, you make the record. Okay. Let us, I had a great meeting with staff and the vice chair, and I heard a lot of really good things as far as progress being made on our work plan. Do we have the work plan that we could pull up?
I was just about to do that.
Thank you so much. I just want to, so I think there's a lot of really good things. I think I'm going to start on the AAPI project because I know there's like a couple of different steps, or there's some really good progress there and some next steps. And then we can look at the other areas and we can go from there. It's AANHPI. Is that the correct, am I saying it correctly? Okay, AA. All right, let's go through our work plan. If we can, thank you so much. Okay, the funding programs provide human services organization. Okay. You heard CDBG being updated. I am going to save the his rap commentary. Matter of fact, or I can ask our council liaison to share her perspective on and staff to talk about his rap and what happened on Monday night. Your choice, everyone.
Sure. So the chair and I presented to the council the HRC's contingency plan, and it was a very good conversation. The council was supportive of the HRC's deliberations and contingency amounts, with the exception of one of the recipients, and that was Ada's Cafe. So the council made a decision to take around 45,000 out of the general fund, and that will be added into the HISRAP fund, so that ADAs will get about a total of $52,000 for each of the 2 fiscal years. And staff continues to, I say staff, Elena has been in the middle of trying to execute these 22 contracts. And it's quite the endeavor, especially when we had two amounts of what they were going to be given. But that is the update. And then if the council member wants to add any nuances, because there was a good discussion.
Has the commission been advised about the 2 that dropped out?
I believe I did that at the last meeting. If I did not, the reminder is that 2 of the applicants that were awarded money declined, and that was Cassie, because the school district went to an internal model for counseling at the high school level. And the other one was Palo Alto Renters Association, as their key staff member was going to go for advanced education, and the rest of the volunteer staff members didn't feel like they had the capacity to implement and manage a grant. So that money was divided proportionally between all of the recipients that were not already at their asked for amount. And that is the normal process that staff follows when a grantee drops out after the funding allocations have been approved by council.
Thank you so much. Councilmember.
Thank you, Ms. Vanderswag. And thank you for all your work. Your presentation was really excellent the other night. And yeah, I am new to council, but it has been 8 months. And I have to say that getting to just be a part of the HISRAP process in a small way as a council member, which is really simply to acknowledge and affirm and thank the HRC for your tremendous work. I know it's a joy for me to just get to be a tiny part of it. So I want to thank each one of you. Can you raise your hand and remind me if you were on the subcommittee that did the 20 hours? Yeah, thank you. and to all of you for bringing that recommendation forward. I think it's safe to say that you're currently working with a city council that, which is not to imply past city councils have not been this way. But I can say with certainty that the 7 of us are really committed to trying to ensure that the organizations that provide the very services we call HISRAP funding, that we want to be supporting them. So I'm a member of the Finance Committee as well, and as I believe I've reported out to this group before, the Finance Committee is interested in the question of should more dollars be allocated to HISRAP, not just on a sort of ad hoc basis as happened this year with an additional 200,000 coming, which you had planned for. That was your upper level of your ask. And I guess what I'm saying is your upper level was funded. So what are you going to do in 2 years? In 2 years, I hope that we will have had more discussions about budget for HISRAP. I think there's no question that HISRAP is serving the most vulnerable and underserved humans in our community. And we want to be sure that those dollars are adequate. And it's clear they're not yet. To the Ada's Cafe, I think the discrepancy for us was, with due respect for the work that had gone into making the decision and an understanding that their application had not really risen to the level that the others had, and tough decisions had to be made. We, I think, had heard such an outcry from the community that Ada's is essential. We have to really figure out how to bring them up to the level of the others, most of which were funded at a much higher rate than Ada's was. So that's why the additional 45,000 was brought in. Gratitude, I hope I've conveyed that sufficiently, just for the work and the heart and the head work that goes into this. If I may, while we're on this subject of your work plan, item 1, I do want to just speak, if I may, to a different recipient of funds from the commission, the Move Mountain View Gang Road site. As we know, this is our one safe parking lot in Palo Alto. As we know, humans live in their RVs and in their cars, both in that safe parking lot and outside of it. There are humans living on El Camino in cars and in other parts of the city. And it is clear we are not yet doing enough to meet the needs of those humans. I'm speaking as an individual right now. I'm not speaking about council policy. But I will say that thanks to your work, thanks to staff's work, the Gang Road site, I toured it recently. It appears to be thriving. And I've heard from Move Mountain View that they regard it as their flagship, even though they are called Move Mountain View and most of their locations, say parking, are in Mountain View. They regard the Gang Road site as the best one, or the highest level of service they're able to provide, because of its showers and its bathrooms and its laundry and its children's library and its clothes closet and its room for a therapist to meet with residents and social work support. And so the question on the table for some time to come, I imagine, will be, is 12 slots at Gang Road adequate to meet the needs of RV and car dwellers in Palo Alto? And it's a question that I find captivating, and I imagine you do too. So I look forward to continuing this conversation with you and with my colleagues on council. Thank you.
Thank you. Just one note, just so everybody's clear on how council came up with the number for Ada's Cafe. It wasn't just an arbitrary number. It was very well thought out, I think, in the sense they said the average recipient receives 76% funding for their request. So what they did with Ada's as a special case is they matched the average of what was given to other recipients. Unlike some others, this funding to Ada's will be run through the regular HISRAP process, so that there won't be any weird cutouts like what me and staff were having a conversation about earlier. So it's a very clean situation, and I think like I said to council, I think everyone that applied was a stellar candidate. Our decision is not a judgment on an organization, it's a judgment on an application. And, we are well aware that Ada is a phenomenal asset to the community, but I just have to say thank you, council, for stepping in. We're grateful for the work we continue to do.
I appreciate that. And thank you for going to the nitty gritty of the funding. It was critical to us not to take funds away from those who had received higher levels of funding from the HRC. And so that's why we made an allocation from the general fund to augment essentially the dollars you were able to work with.
Thank you so much.
Thank you.
Staff, is there anything else on this funding piece?
I would just say that those that are on the Emerging Needs Committee, you'll probably be hearing from us in the next week or so regarding reviewing some applications. I will say that the request for proposals for the HISREP needs assessment is live. There was a little bit of a delay, unfortunately, in getting that out, but it is currently out with, I think, just 3.5, 4 weeks for.
Is this just the RFQ?
This is the RFP.
RFP request proposal.
So we can go straight from the review of the RFP to selecting a consultant.
And were any commissioners engaged in the RFP review?
Commissioner Shea and Commissioner Kraus were both involved
Okay.
in that process with me.
All right, thank you. What is the tentative timeline? I'm sorry.
I can take this. So the timeline is that we're hoping that their report will be done in May or June of next year to give the HRC enough time to review it so that by the next December, you can make any changes to the priority of needs, or if you want to consider any changes to the process. So the primary entry point that the HRC will have with this is how it intersects with the priority of needs.
Okay. Thank you so much. And thank you both for your feedback to staff on this. What's the next item?
The next one is inclusion belonging. So on the top of that is the AANHPI project. So if any of the members of that ad hoc subcommittee would like to give an update.
Yeah, we have tallied the survey responses and found the preliminary key findings. We would love to share with the HRC soon and have an invite public comment for any perhaps more qualitative feedback folks may have or additional perspectives on what we've just decided were the key findings. So we will be distributing some of our findings in advance so that people will have an opportunity. People from the AHNPI community can come and share whether or not they find that the results really reflect their experiences in our community. In addition to that, we've also asked with Minka's help that the recent Palo Alto Community Survey responses be analyzed by race so that we can compare and look at whether or not there are different priorities for our city within our marginalized and underrepresented communities. So that will likely happen, I think, in probably Q1 of next year.
Right.
Yep.
Yeah. So what we have is that the responses from the AANHPI can be singled out into a separate report that the subcommittee can review. The city is still looking if it's a complete report by race. So that part I haven't heard back from, but at least the carve out for the AANHPI community can be part of the results that the subcommittee can bring forward to the council. And I can tell you, I've seen the presentation already and they've done a wonderful job.
I've heard, but and I can't see it until they present it. Subcommittee. And it sounds like there's two parallel things happening at this moment. There seems to be the survey results that are collected, and there's community survey, which is a separate piece. Is that correct?
Yeah, those will be available in mid-December, the survey, the city's community survey.
Is there any way that you could be prepared to present on the first piece in the October or November timeframe?
Yeah, that's what we're planning.
Is there anything we as a commission have to do to get prepared? Is there any outreach? Do we want community? Okay. What does
Yeah,
that look
so
like?
staff is, Elena, is creating a flyer. We were just waiting on when the will of the commission for this report back and listening session to happen. So then the hope was that the commission would refer back to the Google document where you had outreached and had logged your outreach, and that you would take responsibility for, once again, sending this invitation to the listening session personally out to the people that you spoke to about the survey.
Okay.
So I think that the presentation is in really good shape. So if the commission wants us to, we can present in October, but we need to get then, well, but I don't know how long, we need the flyer and we need to do the outreach ASAP.
So
We're doing
we have
October,
30 days?
less than 30 days because the October meeting, I think it's like October 9th or something. It's early. I looked.
Yes, it's a 5-week month, so it's the 12th.
It's
Okay.
okay, not the 9th,
But
November 9th.
I would say, I would encourage you to do it in October and push hard because I've been in Palo Alto long enough to know that if you wait till November, people start leaving town and finding reasons to travel and want to go to Tahoe and ski. And am I wrong? Don't. So I would say October would be a good month to start to get the people engaged.
And actually, November 9th is the day before Veterans Day.
Oh, it's over.
So-
You gonna go skiing.
So-
They're gonna be on the mountain.
I won't, but
I'll be
it's-
trying to go to a beach, but somebody's going to a mountain. All right,
so
so
that makes sense.
So I think then the subcommittee, our next step is just to take the flyer we'll create a flyer for the October date and then share it back with the list of folks.
I'm so
And we may, oh yeah,
And we're announcing now.
yeah.
We'll be
If
reaching
anyone's
out.
listening and you're interested in seeing the results, please
Somebody
look on the agenda next week,
somebody in the
next month.
newspaper's watching tomorrow.
Yes, all right.
So I would say as long as we have 2 weeks to advertise it, so
Um,
if we can get the flyer by the 28th. I'd like to request having the completed flyer by the 28th to give the commission at least 2 weeks to advertise.
That won't be a problem.
All right, that's great work. Great work. Thank you. Equity work through partnering with the city on creating policy language and bias training for commissions. I had the distinct opportunity to sit on the phone on a Zoom call for all of 8 hours last week as we interviewed several candidates for the diversity officer for the city. So I know the city is moving forward to get a diversity officer. Really good candidates. I mean, I think there's out of 6 people, there are 3 that if they picked any one of them, different strengths, there at least would be some change makers. So I've also talked to the assistant city manager, Chantal, and I've talked about the commission training and some other stuff, but I don't think we see that thing move until they get the diversity officer in. So that's where we are with that. What is, okay. Public safety, can we start I know you were going to do it as a commissioner report, Commissioner Savage, but I think you can kick the ball down, and then I'm going to ask Commissioner Kraus to talk a little bit about the FBI thing, the citizen. Didn't you do the citizen training? I can't hear me. Commissioner Kraus, did you do the FBI training?
I did.
Okay, so I could talk about that after Commissioner Savage does the PD report that she told me about
Okay.
earlier.
Okay, so Chair, you're asking me to give the report now? Okay, got it. Okay, a couple weeks ago, Commissioner Causey and I spoke with Palto Police Department, Captain James Reifschneider. And here is what we discussed. It was 4 main items. The first was crime. And there's been an uptick in crime, no surprise there, particularly at Stanford Shopping Center, which continues to be a target for organized retail theft. In fact, the police have found that the same groups that target Stanford also target Santana Row and all the other high-end shopping centers. The captain emphasized that Palo Alto Police have a very good relationship with Stanford management and its security team in helping to fight crime. Another big crime in Palo Alto is catalytic converter theft. It's still with us. Usually happens in the middle of the night, he said. And for a true professional thief, it takes about 2 minutes to grab the converter. And the resale value is about $100. And the neighborhoods that are most affected by this kind of theft are those that are close to a major thoroughfare, El Camino, Middlefield, 101, so that they have a quick getaway. So in an effort to deter crime in Palo Alto, City Council recently voted unanimously in favor of license plate recognition cameras. They approved a total of 20 cameras. So far, 8 of the 20 have been installed and are operational, and that means there's about 12 to go. Some of these cameras are deliberately focused on El Camino and other commercial districts because that's where a lot of the crime occurs. And according to Captain Reifschneider, they have already helped in deterring some crimes and solving some of the investigative cases. Next, we talked about hiring, which is always an issue. They are budgeted, Palo Alto Police Department is budgeted for 86 officers, and there are currently 9 vacancies in the department, which means there are a total of 77 officers in the city. Recruiting is and always has been a huge issue for police, and it's not just a Palo Alto problem, it's a nationwide problem. So what Palo Alto is doing is trying to hit all the major recruiting events. They're also doing community events, athletic events, anything to broaden the pool of candidates. Next is community issues. A lot of the programs like Citizens Academy, school resource officers were halted when the pandemic began. And the department is very interested in resuming these, but because of the budget and staffing issues, it has been very slow to restart. The hope, though, is in 2024, the Citizens Academy will begin again. And being a graduate of that, I can tell you it's a great community event. Yes. Some of the other recent community events police were involved with lately were the Municipal Service Day on Bay Shore, and the Midtown Ice Cream Social, which was just the other day, and a National Night Out, which is an annual event. This year, the police did it a little differently. Normally, they close off Forest Avenue in front of the police department, and a lot of activities go on there. This year, they decided to change it, and they had 2 events, one at Bull Park and one at Johnson Park. And apparently, they were both a huge success, especially Bull Park, which is located in Barron Park. Park rangers were there, animal control officers, the fire department, and it was a huge success. So it looks like this might be repeated next year. Coming up are 2 community events. Airport Day, that's on September 24th. The police will be there. And also their Breaking with the Law event, otherwise known as Coffee with the Cop. That'll be later this month, later in September. A specific date and location has yet to be named, but you'll be hearing about it shortly. And lastly, the new police building, the status It's actually beginning to look like a building, finally. Almost all the scaffolding is gone. Some interior work is still going on, but construction is hopefully will be completed by the end of this year. And the first wave of employees should be scheduled to start in either late January or early Feb. And everyone should be completely moved in by the spring of next year. Right off Cal Ave. That's it.
Commissioner Krause?
Yes. I had the honor of attending with Daryl, for the most part, the FBI Citizens Academy. And it goes for 8 weeks. And it's a marvelous program. It's informative, it's cultural, it's societal. You get people from many different walks of life, different parts of the Bay Area. We hosted it. Now Police Chief Bender welcomed the FBI and kicked off the first session. And the people who run it take explicit care in making sure there's information that's conveyed. And if you have questions, they stay around and answer. And they go all sorts of functional areas. The first was really finance oriented. What happens in these financial machinations, whether they be inside this country or they be external and international. We moved on to hate crimes, and we talked explicitly about hate crimes. The head person, I don't know the name.
Yeah, the SAC, the special agent in charge, Robert Tripp, attended every class, which, he's in charge of the whole Northern District of California.
Oh,
And
wow.
For him to schlep, I have no other word for it than that, every week to Palo Alto was really impressive, and it shows how important the Citizens Academy is to the FBI.
Because it's a major opportunity to get information out to the community, as well as to begin recruiting.
Okay.
And then the final sessions were on human trafficking, whether they be by email or they be by women and young men that are trafficked on social networks, online, in the public web, and in the dark web. And we culminated with having Special Agent Marty Parker, who is a plus 20-year veteran, come and speak to a nonprofit as well as open to Palo Alto residents. A session that she talked and answered questions and was available online. So it was a real honor. That's a word that comes to me. It was an honor to get to know these agents, to understand their specific roles and their areas of competency, and to have the special agent in charge sitting in the back of the room through the entire 8 weeks.
That's absolute. This sounds absolutely phenomenal. I know that we who's ad hoc? I'm sorry.
I'm sorry?
Who's the ad hoc for this?
I don't know. I can't look without it showing up on my screen, so maybe Elena can look it up.
Okay, because I know we have we wanted to do some what was this? Community conversations, and also have the FBI come and talk to the community. I know we had some conversations with them. Have
Yes.
we? Are we still in limbo? Where are we with that? It's like 24 months now since we
Yes,
made the
staff is
first
just
request.
waiting for the subcommittee to determine a little more focus and so forth. I still have the agent's name in my inbox, so.
I thought we were going to do hate crimes.
Right, but just so we could frame the conversation in the way we specifically want it to be framed. So I'm waiting for the subcommittee.
Is there anything I can do or Daryl to facilitate this?
I don't need any help in like the mechanics of it, but my
Okay.
understanding all along was that the subcommittee was going to just, provide the framing. After the first meeting, there was some discussion about the framing. Hate crimes are goal number 3.
And Chair,
For public safety, I have
the
Commissioner Kraus and
conversation
Commissioner
with Marty
Savage.
Parker is available for the commissioners.
Thank you so much. Alana, say it again, please. The names again?
Commissioner Savage and Commissioner Kraus for public safety.
Okay. So
Yes.
I think if we could come back in October with a couple of thoughts and topics for the agent, because I see we have hate crimes, human trafficking, online targeting, and training local businesses and hotels on how to recognize and de-escalate hate crimes and incidents. If we can come up with something we can go back to the nice agent that staff has and say, we want to do the training, or if there's another approach you want to take. Because I know we started the process of talking about bringing in the FBI for training. That might not be the right approach anymore. But how do we what's our next steps on these public safety items?
Why don't we work together, develop them, come back to you?
Because it might not be anything, but we'll see. All
Yeah,
right.
I'm happy to.
Yeah, yeah, we can get in touch with the agent who
That's
you
right.
spoke to before,
Mhm.
Michael Gimbel, and arrange something.
Okay, thank you all so much. Thank you. Next item. We had how did we do with the kids? The climate change, thank you.
Great. So they came and spoke at our last meeting. They gave us a whole presentation and report. We asked questions, provided them with feedback. It's still, a draft.
Mhm.
So we did give them some ideas and offer to help them. And then they're gonna go back and then eventually return back to us. And I'm not part of the ad hoc committee, so I don't know if whoever's part of it.
I was part of it, but
Okay.
my maternity leave.
So I don't know if anyone else has anything else to add to it, but they came, they did a great job. And I think we had some great conversations and some great ideas and for them to look into other things. Go deeper, I think, a little bit.
So, is it on Kat Snyder and her coalition of young people? Is that who's the ball's
Yes.
court?
Yes.
Well, they've had at least one person leave to go to college.
Right. Katie went to
Katie.
college.
And they know this, right?
Pardon me, Chair?
And they know this, right?
Yes.
Yes, although it was just one of the subcommittee members that was here last time. It was,
The young woman,
yes, that much I remember off the top of my head.
me too.
Her name is escaping me.
I actually don't know that it's clear what the next steps are on this work stream, because when we met with them, it was that they
They
were
were
gonna finish this
graduating.
report and then they were all graduating. And then when they came, there was much more talk about it as a draft, they should come back. But it was unclear to me that any of the students are actually available to do much additional work. So so maybe we need to loop back with them and just find out if they have interest and ability in doing more.
All right, so yes.
May I weigh in here? I've had
Yes.
some involvement with the Palo Alto Student Climate Coalition and was just at a meeting a couple weeks back of the Palo Alto Youth Council, which is newly constituted for the year. My impression is that they are just newly back up and running, whether it's the Youth Council or PASC, with Katie Roof having graduated and gone off to Cornell, I believe. There is new leadership in place, and I think they are more eager than ever to work with y'all and with the council, figuring out what that means. But I think they're planning to come forward to council with a proposal for deeper involvement with us. And so I would think they would be excited about the opportunity to work even more closely with you.
So, is Kit Snyder still the point of contact for them, Minka?
She is, yeah, she worked always in tandem with Katie when they were planning meetings and so forth. I think based on what the council member said, I think it would be good for the subcommittee members to get a hold of Kat and just ask for clarity is, are they planning on going a different route through council, or are they planning specifically to finish their report for the HRC, or are they planning to hand off what they've done so far and they're going to pursue different aspects of the topic with them? So I think if we can get some clarity on that, that would be helpful.
I can take that as an action item to follow up with them.
Thank you so much. All right. We were to do some learning sessions.
This is Commissioner Amy and myself. We had a major, I briefed Minka and staff, and we have a question of if we want to have a number of public health officials, in particular the Santa Clara County Public Health Officer, Sarah Cody, do we want her to come here and present as the seniors from Avenidas did? Or could we hold, or could we do both? Can we hold a public session, a listening session for constituents of Palo Alto as we get ready for the next season of potential disease? It's no longer a pandemic, but we've selected the people, we've got them identified, and I needed that direction, as Amy and I discussed, of what you would prefer, and then we will go lock it in.
So in my experience, I think our most effective public outreach events have been when we've gotten a space outside of here. So maybe Mitchell Park, the large community room, or the other library where we get the room, and then we make some sort of advertisement, not that this is a HRC meeting, but this is an event with these people to have this conversations. I mean, I think one of the first times I got engaged with the HRC, we did the race in Palo Alto piece at the library, and there were probably 150 people there.
Okay.
And I think right now is the time. I think particularly we're seeing a resurgence, even though it's COVID's endemic, not pandemic anymore, but RSV in kids, new waves of COVID, public health is a significant challenge. So I think that's great. All right.
So I agree with you, Amy.
I think you just have to coordinate with staff because, you know, they usually have to figure out rooms and marketing and budget.
Exactly.
And we'll go from there. All right. Well, don't go anywhere. We're not done. The next one is lack of community and walkability in South Palo Alto.
Can I just add one thing? I think it would be interesting if you could do it soon, if she could address any concerns about there's a new COVID vaccine getting rolled out. And I know that there's a big, obviously push for people to get vaccinated. So it would be great if she could speak to that.
I will now reach out, find out her availability, and staff, if you could make us smart about available spaces, we'll go forward.
Thank you.
So
Recommendations in terms of like time of week, time of day?
I don't think there's any perfect time.
Yeah,
We've done events almost every night of the week at this point.
yeah.
And I think it's more the energy around the topic.
Mhm.
I would really work with Minka. I've worked with, she's done these community events for years. So she can give you some really good guidance around spacing,
Sure.
time. She can also, she sits on the calls with nonprofits, so she can have a pulse of what some people are thinking community. So I would really work with her on that. All right.
Problem.
The lack of community and walkability in South Palo Alto.
That's Commissioner Causi and I, we were supposed to meet and then she had a medical emergency and we have not been able to reconvene.
Mhm.
So hopefully we can meet before the next meeting. I am excited that City Council stepped in and helped to save Mike's Diner. So
Thank you.
that
That was good.
was great. So that's 1 point for South Palo Alto.
We just need to get the cleaners and then.
While council members were involved in that effort, I think in particular the mayor, frankly, I think it was the entire community. Over 1,500 people signed a petition. There was heartfelt concern and outrage, and I think it was wonderful to see what our community can do for a cause when we all rally behind it.
Mhm. So it sounds, knowing the tempo of life, we probably won't really deeply engage in this until early next year.
Yes, I don't think we're going to be able to.
Okay.
Yes.
Who's doing issues face? Oh, yes, you guys. Is there anything else you see in this calendar year bringing back on seniors?
Yeah, we have a listening session actually in the next meeting as well in October with 5 different service providers.
And given the stats we heard today, it's very important.
So, well, yeah, so it'll be, and that'll be a continuation. It'll be part 2 of this conversation we started today.
Thank you so much. Next item. All right. Is there anything that has come to any of our commissioners' attention that we as a community need to be talking about or addressing that hasn't been covered? I know, to give you examples, in the past, we were able to engage in conversations around COVID very early because we have discretion to be the canary in the coal mine. We were able to shift our whole plan around the tragedy with George Floyd. So if there's something that you're seeing in the ether, we as a commission would love to even have a thought on it. It might not be a fully formed thought, but at least let's have some dialogue around it.
Well, last time we had speakers on reparations
That's
here in
nice.
California.
Mhm.
And I know Commissioner Stimler brought it up at the end of our meeting, and then we talked about reaching out to them. Have we reached out to them? Minka, to have them come and talk to us?
I'm waiting to hear some information about timing
Mhm.
because even our October meeting is looking quite long at this point. So I think leadership will have to do some prioritization, but they have not fallen off the list of things to be on upcoming meetings.
Who's doing the reparations?
I don't have the name specifically in front of me. There were 2 women who were on the state, I think are Bay Area representatives on the state commission,
Marie?
and they were from East Palo Alto. I don't have their names in front of me, but, and Maura Uman from YCS was another speaker that encouraged the HRC to have this, to hear the report.
All right. I think that covers it.
There's one thing, Mayor.
Yes.
There's a rising problem in downtown Palo Alto with merchants being pushed out by landlords. For example, one of the dry cleaners, which was next to the French restaurant on Bryant Street, essentially got pushed out by her landlord to expand the French restaurant into that space. I personally helped her find a new space, but I think that, which is on the other end of Hamilton at the corner of Cowper. But I think those are issues that we and the council should be looking toward, of how we manage the services and the merchants that provide these services from becoming a desert. They just are getting pushed out by very aggressive landlords, not only in South Palo Alto, but right here in downtown.
It's interesting. I learned more about parklets than I've ever wanted to learn this week. And I also learned a lot of concern around businesses. Are there people like Charlie at the chamber or any other business associations that can help us quantify and talk about some of these conditions? Because I know one of the reason I bring up parklets is one of the questions that were brought out of that conversation was the diversity of vendors on streets and diversity of people, and how do you make a community that makes sense? And if this is happening in a pattern, not just an instance, maybe we can get some business leaders or small business people to really do it. I know that I'm speaking for the chamber in October, so I can reach out to Charlie then and ask him that question. Yes.
Right, and I would just encourage the HRC to, when you're having these conversations, think about it within the role of
I know.
the charge of the HRC. Because I know this could creep pretty well easily into other areas as well.
I think Commissioner Kraus described it best. She says, when we start creating deserts in our community, where there is a dearth of services, and I grew up in a city in Mount Vernon, New York, that was a food desert. And you had to drive out of the city. And I never thought I would move to one of the most affluent cities in the country and then be like, we have a desert. I can't even find a dry cleaner. I got to go out to that city.
That's what I'm trying.
But I'll use that because that's, Molly Stone's is never closing. I'll always have a grocery store. Yes, yes.
At the risk of participating in the creep that Ms. Vanderswag is trying to.
She's trying to hold us back.
Hold us back.
I know.
I would also offer that maybe Steve Guagliardo, who's in charge of economic development and revitalization for the city, would be a wonderful person to speak with, because as we know, all of these issues can be viewed through a lens of equity. When we're thinking about how to revitalize the city, what that even means, what are the metrics, what matters as we approach this. We could be deeply inclusive of all as we revitalize, or we could decide to prioritize things that really leave a whole swath of people out. So I think he'd be a great person to speak with, as well as Charlie Whiteance at the chamber.
Yeah, I was thinking of having Steve be part of that conversation.
And there's an ethnic issue, there's ethnic issues involved. In particular, cleaners are usually Korean. And there's some manhandling of the people involved that don't speak good English. It was ugly, just so ugly. And we need to stop it at some point.
And I think when we're talking about private property owners, we have to keep in mind that we don't have a lot of control. At the same time, there are carrots, if not sticks. So the way in which the community communicates about all of these issues in small ways, in large ways, in the media, really shapes the personality and character of the city. So I'm excited to
Exactly.
see you have this conversation.
Yeah.
So, thank you, everyone. Why is it on the top of my head? Did we have something to do with the cast piece? Yes.
We took a position of referring it to you and asking you to engage in dialogue and make a recommendation as to what the city should do. In the interim, the bill has moved forward in the assembly. And maybe Ms. Vanderswag knows more than I do.
No, I do not know more than you do. I think it moved forward quicker than expected. So when the council had made that referral to the HRC, and then I think it landed on Governor Newsom's desk quicker than expected. So I think we're going to look to see what happens there and if there's a role to come back to the HRC.
So, I would like for the HRC to actually start that process now, for a few reasons. Whichever way the governor goes, we've clearly hit a sore spot. It's a clear sore spot. I've never seen most people don't complain about equity unless there's some sore spot there. Given that we live in a community that is 34% Asian, and a significant part of that population is Indian, and we have businesses that are significantly in this area, this should be a question for us to at least ask, is caste impacting our community? And how is that having a human toll or cost in our community? So I would like for us to pick that up, because whichever way the governor goes, the can is already open. Commission, any thoughts? I see a lot of looks.
Yeah, sorry, can you just, I'm not familiar with what's going forward with the governor.
So basically, there was a female Indian legislature that I can't pull it out of the air. I think what's the exact terminology?
Senator Wahab
Yes.
from Fremont proposed legislation to ban discrimination based on an individual's caste under the UNRRA Civil Rights Act,
Yes.
which has all of these protected statuses
Yeah.
who may not be discriminated against in California. And the
Thank you.
proposal was to add caste to the list of many classifications and identities that would be protected. It's called SB 403, and it did pass the Assembly and the Senate recently.
Sorry, we thought you said CASP with a P.
No,
So
can't.
SB 403.
Yes, I'm sorry if I didn't pronounce it with enough clarity. So to add a little bit more context to that, there have been certain parts of the Indian community that have protested vehemently to not have it added to the anti-discriminatory paperwork.
Chair, I can't hear down here when you turn.
I'm so sorry, I said, and the reason I am highlighting it is because there's certain parts of the Indian community that have protested vehemently to not add it to the anti-discriminatory laws of our state.
Okay. Thank you.
Yes, go.
Having sat through a number of public comment sessions where we heard from people on both sides of this bill, I think I can summarize the situation as a set of people who feel that caste must be added to the list of protected identities and statuses so that people have a remedy if they are victims of caste discrimination in our state. On the other hand, there were people from the same ethnic background, cultural background, saying, please do not bring this concept here to California. We don't have it here. We left it behind. Our children don't know what it is. And if you put it out there, then our children will be discriminated against because they will learn that some Hindus discriminate against others on the basis of caste. It's, in their view, bringing to the present and into California an issue that has been left behind and is located elsewhere. the people I've mentioned first think it is very much present here, would say, I have been discriminated against. And then the others in opposition are saying it is not an issue here, and you will make it an issue if you put it in, into our California Constitution.
As an immigrant to this country, I'm well aware that people don't leave back at home things. They bring them with them, even as a 1.5 and second generation. So I'm very interested in seeing this. So I think, is the commission willing to look at this? Well, the council already gave us a mandate, right?
This was a council referral.
So anybody want to work on this? Or is this all mine? All me all day? I got it. Okay.
Can you just talk a little bit about what kind of work is required?
I have no idea at this moment.
I don't know, that's why I'm asking you.
Yeah, I have no, I think I'm going to have to sit.
Yeah.
I have one person in my congregation that is of Indian descent I have a few people in my congregation that are of Indian descent, and I'll have a conversation with them. And I ask them to guide me how to deal with this topic. I think that's probably my first step, because they'll at least have an honest conversation with me.
Yeah.
Yeah.
The other thing I would just, I know that when in the survey, we asked in the Asian, Native Hawaiian, Pacific Islander survey, we did get a couple of, we asked people for other contacts within the community we could reach out to for more information. And there were a couple of Indian resources, so we could also pull that data out of the survey. I know that there's like a South Indian, like Palo Alto WhatsApp group, for example.
Oh,
So
nice.
that could be another resource for you. Yeah.
Okay,
digging in.
so I will work with staff, because just so we understand like our process. You bake the cake, or you try to bake the cake, and then you have to come up with like not only a great idea, but like the resources, facts, and cogent information for us to work on, and then we can bring it back to a meeting. So like, I'll throw it out here and say, can we work on it? But then I have to go bake the cake and put everything together before I bring it back to the commission.
I certainly have access to large numbers of the South Asian community through the political work I do.
Oh, that's great. I can only reach out to one commissioner, and then I'm in Brown Act territory. Is that correct? Oh, I got two. So I'll reach out to both of you. Thank you.
Yeah.
Thank you. So I will do due diligence this month, and then we go from there. All right. Do we have any other commissioner reports? Because I think I tried to get the commissioner reports in the work plan, so we wouldn't have to have another piece. Are there any other commissioner reports? Pam?
I'll go ahead. Commissioner Stimler and I met with the leadership of PAM, the Palo Alto Mediation Panel, Diane and Adrian, and they are interested in coming to one of our meetings to talk to us about what they do and any trends. So sounds like October is a no-go, but maybe they can come in November to present?
Yes. Staff, is it still in their bylaws that we have to approve the people? Oh, they got rid of that. I wonder why. All right, let's do November.
Is that
Everybody, and can you tell us for everybody's recollection exactly what the initial PAMP stands for? Is it Palo Alto?
Palo Alto Mediation Program, not panel. I
Okay.
always do that.
All right, so that will come forward in November. Yes, Commissioner Shane.
Yes, so I had an hour meeting with Mary Gloner at Project Safety Net, because since I'm the liaison to Project Safety Net, and we are going to be meeting at the end of the month, and I'm going to be reviewing the results of our NHPI survey, and she's also interested in attending the next meeting.
So she'll comment in our next meeting. Oh, that's a phenomenal. That's great work. Thank you. Anyone else? Y'all been busy. All right. If there's nobody else, is there anything, staff, you'd like to say for the good of the order?
No, Chair.
Okay. Have we missed anything, Commission?
Was there anything else from the council?
I think I
Cassie?
managed to cover everything in response to, our agenda items as they arose.
Oh, there is one thing from council. We still have to do the holiday report. I think I'll ask the vice chair to do that one because, we can't have both of it, that midnight duty. I'm not built for that. So when is the holiday report? I had a thing on my calendar for October 2nd.
At one point, they tentatively told me if one of them didn't go on Monday night, it'd go October 2nd. So I will work to see if so for the council member, we call it the holiday report, but it's the response to advancing dates for race and equity.
October 2nd?
I do not know.
Okay. I don't think anyone knows right now.
I will find out.
Okay. And what about the renters?
So with the renters, so
Do we
so
want to table that till the next meeting?
sure.
Okay, because it sounds like we're about to go on a long journey.
Oh, I was going to make it short, which is pretty good for me. So
Okay, go ahead.
I will say that they don't plan on going back to you at this time because they responded to your questions within the body of the report that went to council a couple weeks ago. It went to the council ad hoc a couple weeks ago.
So we have nothing else we need to do for that.
They will see if they will come back to you with another version of the ordinance for the rental registry program, but we don't know specifically at this time.
And have we all received that report to review?
I included that when I sent out an invitation to the meeting of the council ad hoc
Good.
housing committee.
All right.
Which you attended and I attended.
All right. Everyone, thank you for your time this evening. Please go safe, and we will see you next month, same time, same place.